Hi everyone, in this video I am explaining about the anatomical terms and brief explanation of units of gross anatomy. So the basic anatomy, this video is mainly for the pending medical students who don't know about the anatomical terms. To learn the anatomy easily, you should know the anatomical terms. First of all, we will look at the what is the anatomical position. So you can see in this image the anatomical position is when person is standing erect and upper limbs by the sides and face and palms of the hands directed forward. So this is the anatomical position. So you should know what is the anatomical position. Then we will look at the various imaginary planes in the anatomy. So there are three main planes in anatomy: median sagittal plane, coronal plane, and the horizontal plane. Median sagittal plane, you can see in this image, the median sagittal plane is a vertical plane that passing through the center of the body. So you can see in this image. It divide body into right and left halves. The structures near to the median plane of the body called as medial to the other structures, and also structures that lies far away from it known as lateral to the other structures. So we will see it again in few minutes. The next one is coronal plane. So it is also a imaginary vertical plane at right angles to the median plane. You can see in this image, this is the median sagittal plane and this is the coronal plane. The coronal plane lies at right angles to the median sagittal plane. Then the horizontal planes, these planes are at right angles to the both median and coronal planes. You can see this is the horizontal plane or the transverse plane. So it is lies right angles to both median sagittal plane and the coronal planes. So those are the imaginary planes that you should know in the anatomy. Then we will look at the terms of laterality: the unilateral, bilateral, ipsilateral and contralateral. What is the meaning of the unilateral? Unilateral means you can see in this image, the unilateral is one side. It means one side. Then the bilateral means both sides. Ipsilateral means in same side. You can see in this image the upper limb and lower limb at same side. Then the contralateral means the opposite side. The lower limb and upper limb is in opposite side. So those are the terms of laterality. Then there are other anatomical terms you should know before you study the anatomy properly. The first one is anterior and posterior. What is the meaning of the anterior and posterior? Anterior means front, posterior means back. You can see in this image, so this is the anterior or the ventral side. It means front side of our body. So this is the posterior or the dorsal side of our body. It means back side. So that is the meaning of the anterior and posterior. So the next one is the medial and lateral. We discussed it. Medial and lateral means the medial means the near to the median sagittal plane, the structures near to the median sagittal plane, and the lateral means the structures that lies far away from the median sagittal planes. So that is the meaning of the medial and lateral. Then the next one is palm and dorsal surfaces. Palm and dorsal surfaces means also anterior and posterior side respectively. The palmar surface means that when we are talking about the hand, the palmar surface means anterior side of the hand means the palmar surface. Then the posterior side of the hand means the dorsal surface. That is the palm and dorsal surfaces. Then the proximal and distal. The proximal and distal means it describes relative to the root of the limbs. You can see in this image, proximal means near to the root of the limb. Distal means far away from the root of the limbs. So that is the meaning of the proximal and distal. Then the superficial and deep. The superficial and deep, it describes relative distance of structures from the surface of body. The next one is the internal and external. It means the relative distance of structures from the center of an organ or cavity. Okay. Then the next one is supine and prone. Supine and prone means supine means lying on the back. In this picture you can see this is the supine position and this is the prone position. Supine means lying on the back and prone means lying face downward. When person lying and face downward, it calls the prone position. The next one is the superior and inferior. Superior and inferior means respectively the upper and lower end of the body. So you can see in this image, this is the superior end or the upper end, and this is the inferior or the lower end. So anterior and posterior we discussed, proximal and distal also we discussed, medial and lateral and superior and inferior, they are also we discussed. Then the important thing that you should know is the terms related to movements. There are many terms related to movements. The examples are flexion, extension and abduction, adduction. We will look at that. The first one is flexion. You can see in this image, this is the upper limb, and in flexion of shoulder, the upper limb takes to the forwards. It means the anterior side. Usually the flexion is an anterior movement, but in sometimes you can see in this picture this is the knee joint and flexion is a posterior movement. So I told that anterior means front side and the posterior means back side. So in this picture the flexion of the shoulder joint is an anterior movement, but the flexion of the knee joint is a posterior movement. You can see it. So that means the flexion is usually is an anterior movement, but in some times it can be also a posterior movement. Then the extension. The extension means straightening the joint. It is usually a posterior movement. You can see this is the posterior side, so the extension is usually a posterior movement. But in some joints like knee joint, the extension is an anterior movement. The flexion of the knee joint is a posterior movement and the extension of the knee joint is an anterior movement. Then we will look at the abduction and the adduction. Abduction means the movement of a limb. You can see in this picture, abduction, the movement of a limb away from the median sagittal plane or the midline of the body. So you can imagine this is the midline of the body. Then you can see this red arrow. The abduction is it means the upper limb moves away from the median line or the midline. Then the adduction of the shoulder joint. Adduction means the movement of limb towards the body. You can see in this red arrow. Then you can also see in this picture the flexion and extension of the elbow joint. The flexion of the elbow joints, in the flexion of the elbow joint, this is the forearm. This is called as the forearm, and this is the arm. The forearm goes towards the arm in the flexion of the elbow joint. In this red arrow, you can see the extension of the elbow joint. So you can see in this picture abduction and adduction of fingers. The adduction of fingers means drawing together. The fingers are drawing together. You can see in those red arrows, the fingers are drawing together. That is the adduction of fingers. You can see in this picture the spreading of the fingers. That is the abduction of the fingers. Then the inversion and the eversion of foot. The inversion of foot means the medial rotation of the foot, the sole of the foot in the medial side. This is the sole of the foot. They are in the medial side in the inversion of foot. Then the eversion of foot, in that moment the sole of foot in lateral side. You can see in this picture. Then the medial rotation and the lateral rotation. So what is the rotation? Rotation is a movement of a part of a body around its long axis. In medial rotation, the anterior surface of the part of the body, the anterior surface of the part of the body is at medial side in medial rotation. In lateral rotation, the anterior surface of the part of the body is at lateral side. So that is the lateral rotation. Then the circumduction. Circumduction of shoulder joint. You can see in this picture the circumduction means the combination of all four movements. It means flexion, extension, abduction and adduction. The combination of those four movements called as the circumduction. Then the supination of forearm. Supination of forearm means the lateral rotation of the forearm at the elbow joint. You can see in this picture the lateral rotation of the forearm at the elbow joint. The pronation of forearm means the medial rotation of the forearm at the elbow joint. You can see the supination of forearm, the palmar surface of the hand is at anterior side. In the pronation of forearm, the dorsal surface of the hand is at anterior side. Then the lateral flexion of trunk. The lateral flexion of trunk means the movement of trunk in coronal plane. So the coronal plane is a vertical plane at right angles to the medial sagittal plane. You can see in this picture the lateral flexion is a movement of trunk in coronal plane. Then we will look at the various movements of the fingers. This is the thumb. This is the flexion of thumb. You can see in this red arrow it shown the flexion of the thumb, and in this red arrow the extension of the thumb. Then this is the abduction of the thumb and this is the adduction of the thumb. Then the opposition of thumb and little finger. It means the thumb can touch the other four fingers of the hand. That is the opposition. So in this picture you can see the opposition of thumb and little finger. Those are the terminology of anatomy. Those terms you should know before you learn the anatomy. Then we will look at the cross anatomy units. What are the units of the cross anatomy? In cross anatomy you will learn the upper limb, lower limb, thorax, abdomen, pelvis and perineum, head and neck. Those are the units of the cross anatomy. Then the introduction to the upper limb. I will give a brief examination of upper limb. This is the arm from this is the shoulder joint, and this is the elbow joint, and this is the wrist joint. In between shoulder joint and the elbow joint, this part is called as arm. Then the in between elbow joint and the wrist joint, this part is called as the forearm, and this is the hand. So in upper limb you should know what are the bones in the upper limb, what are the muscles in the upper limb, and what are the nerves, blood vessels, joints, and what are the various species, and the clinical points. In my next video I will explain about the bones of the upper limb. If you like this video, please subscribe this channel and like, comments to the videos. Please make sure to click the bell icon so you will receive notification when I added a new video. Thank you.